911. What's your emergency?
Hi, I think I've been stung by a bee. We were having a picnic and my arm's a little swollen.
All right, sir. Have you ever had an allergic reaction to a bee sting before?
No, never. I don't know. But right now, I feel kind of strange.
What do you mean by strange? Are you having trouble breathing?
No, my breathing's fine. It's just, my arm really hurts, and it's bright red. It feels like it's burning.
Is there swelling around the sting?
Yes, and wait, oh God, the redness is spreading. It's spreading really fast.
All right, sir. Try to stay calm. Can I get your location? I'm sending an ambulance.
Riverside Park, picnic area, west side. Please hurry. My wife's scared and...
An ambulance is on the way. They'll be there in 6 minutes. Stay on the line with me.
Okay, thank you.
I will never forget that day. July 14th, 2023, a Saturday. I had been on shift in the ER since 7 in the morning, and honestly, it had been a quiet start. A young man came in with a sprained ankle from playing basketball. 2 migraine cases, both women, both after a stressful weekend of shopping. Normal things, really. We had our routine, you know. I was sipping my coffee. It was already cold by then. I was chatting with Nurse Sarah, who was telling me that her daughter had just finished high school and was preparing for college entrance exams. Right then, the voice came over the intercom. Dr. Richards, incoming trauma, Bay 3. ETA 4 minutes. When they say trauma, usually it means something serious. But that morning, I didn't think much of it, because right after, the details followed. 42-year-old male patient, possible bee sting, suspected allergic reaction. A bee sting, routine. Maybe some swelling, maybe a mild allergic response. We give antihistamines, a cold compress, observe for a few hours, then send them home. 2 hours max. I finished my coffee, washed my hands, straightened my coat. Sarah was getting things ready, setting up the IV, turning on the monitors. Probably nothing serious, I told her. Just a bee sting. She nodded. We had seen so many bee stings, hundreds. Most were nothing, most went away quickly. Then I heard the ambulance siren approaching. I moved to Bay 3 and stood by the door. The paramedics pushed in with the stretcher. On it was a man. Later I learned his name was Michael. 42 years old, looked healthy, not overweight, in good shape. His wife was running alongside, Jennifer, her hands trembling. But the first thing I noticed was Michael's arm, his right arm. And in that moment, the thought, probably nothing serious, vanished completely. Because the arm looked terrible. From wrist to shoulder, it was bright red, shiny as if painted, swollen, nearly double its normal size. And Michael was in agony. His face was pale white, dripping with sweat, his jaw clenched tight. "Transfer on 3, said the paramedic. 1, 2, 3. We moved Michael onto our stretcher. I quickly hooked him up to the monitors. Heart rate 110, elevated but not critical. Blood pressure 150/95, slightly high. Oxygen saturation 98%, good, breathing normal. So, it wasn't anaphylaxis, at least not yet. That was the good news. How long has it been like this? I asked. Jennifer answered, because Michael couldn't. He was in too much pain. 2 hours, she said. At first it was tiny, just a little swelling, but then it started growing, fast, very fast. And the pain became unbearable. 2 hours. And in just 2 hours it had spread from wrist to shoulder. That was fast, too fast. A normal bee sting wouldn't spread like this. Did you actually see the bee? I asked. Jennifer shook her head. No, we didn't. Michael yelled, pulled his hand back, and then we saw just a little mark on his arm. I turned to Michael. He was trying to open his eyes. Michael, can you hear me? I asked. He nodded faintly. Where exactly did this happen? At the picnic table, he muttered, voice strained. I was under the table, fixing something, and something bit me under the table, dark, shadowed, enclosed. Bees don't lurk there. Bees fly in the open, buzzing around flowers. What was under a wooden table? What kind of table? I pressed. Wooden, he said. An old wooden table. At the park, a suspicion began to form in my mind. Just a faint suspicion, but I had to check his arm first. "Michael, I need to examine your arm, okay?" "It might hurt a bit." He nodded. Slowly, I lifted his arm. Michael groaned in pain. The arm was heavy, swollen, burning hot to the touch. His skin felt like fire. I searched for the puncture site. There it was, on the inside of his wrist. And what I saw there was unusual. In a normal bee sting, the stinger is left behind, a tiny black dot in the center, with mild swelling around it. But this was different. Right in the middle were two small marks, side by side, close together, like two tiny needles had pierced the skin. "Sarah, can you bring me a magnifying glass?" I asked. The nurse hurried back with one. I leaned closer and studied the marks. Yes, two punctures, no doubt. And surrounding them was a faint ring, purplish, almost bruise-like. This wasn't a bee sting. This was something else. "Jennifer, tell me again. Where exactly were you?" "Riverside Park," she said. "West Side, the picnic area." Riverside Park. I knew it well. An old park with weathered wooden tables, shaded by trees. A damp, aging place. And in those kinds of dark, moist wooden spaces, certain creatures like to hide. But I still wasn't sure. Maybe I was overthinking it. Maybe it really was just a bee sting, and this was an unusual reaction. "Sarah, I need labs. CBC, Comprehensive Metabolic Panel, coagulation studies. And start an IV, wide bore, left arm, normal saline, 125 per hour." "Got it," Sarah said, and got to work immediately. Michael's pain was getting worse. "Doctor, it hurts." "It really hurts." "I know, Michael. We're going to give you something for the pain, okay? Sarah, 4 milligrams morphine IV, please." The morphine went in, and a few minutes later, his face relaxed a little, but only a little. I looked at his arm again. Now I could see more clearly the boundaries of the redness. They weren't smooth. They looked irregular, branching out like tree roots, almost following the veins. And right around the bite site, about a centimeter in diameter, the skin color was changing. It was turning purple, then grayish. That was bad. Very bad. "Jennifer, I need to ask you something important," I said. "When Michael was bitten, did you see anything else? Any insect on the ground, on the table?" "No," she said. "We looked, but we didn't see anything. It was already gone. Already gone. It had disappeared. Bees usually hang around, buzzing in the area, sometimes even sting again. But whatever this was, it had escaped quickly, because it didn't want to be seen, because it lived in the dark." I stepped out of the room and went to the nurse's station. I opened the computer and typed into Google, "spider bite, rapid spreading redness, necrosis." The first result came up. Brown recluse spider, Loxosceles reclusa. Its venom is cytotoxic and hemolytic. It causes necrosis in the tissue. I looked at the pictures. The bite marks in those photos were exactly the same as Michael's arm. 2 puncture marks, a purplish ring, rapidly spreading redness, early necrosis. But I had to be sure, because if I was wrong, if this really was just an aggressive allergic reaction, I could give the wrong treatment. I reached for the phone and called our toxicology specialist, Dr. Patricia Hammond. She was the best in the hospital when it came to venom cases. "Pat, it's David Richards from ER," I said. "I have a possible envenomation case. Can you come down?" "What kind?" she asked. "Possible brown recluse. 42-year-old male, bitten 2 hours ago. Rapid spreading erythema, early signs of necrosis." There was silence for a moment. Then, "I'll be right there. Don't start any treatment yet. I need to see it first." 5 minutes later, Dr. Hammond arrived, tall, gray-haired, serious. She didn't waste a second, went straight to Michael, examined the arm, used a magnifying glass, took a photo. Then she turned to me. "Classic loxoscelism," she said. "Textbook case. You caught it early, that's good. But it's aggressive. Very aggressive treatment?" I asked. "High-dose steroids. Start immediately. Dapsone if you have it. Antihistamines. Pain management, obviously. And," she paused, "and we need to watch for systemic loxoscelism. If the venom gets into his bloodstream, we're looking at hemolysis, renal failure, Disseminated intravascular coagulation. The blood clots and bleeds at the same time. Deadly. How likely? I asked. With this level of local reaction, maybe 15 to 20% chance. We need to monitor his CBC, renal function, coags every 4 hours. I went back to Michael. Jennifer was there, holding his hand. Michael, Jennifer, I said, I need to tell you something. This wasn't a bee sting. This was a spider bite. A brown recluse spider. Jennifer's eyes went wide. Spider? What does that mean? It means the venom is different. It's cytotoxic, which means it destroys tissue. What you're seeing on Michael's arm, that redness, that's the venom spreading. And we need to treat it aggressively. Will he lose his arm? Jennifer asked, her voice shaking. I don't know yet, I said. I couldn't lie. We're going to do everything we can to prevent that. But I need to be honest with you. This is serious, Michael spoke. How serious? If we can stop the venom from spreading, if we can prevent systemic complications, you'll be okay. But there will be tissue damage. The skin and muscle where the bite occurred, we might need to remove that surgically. Surgically? Michael said. You mean cut it out? Yes, it's called debridement. We removed the dead tissue to prevent infection and to stop the venom from spreading further. There was silence. Jennifer was quietly crying. Michael stared at the ceiling, and I couldn't say anything either, because there wasn't much to say. That was the reality. A small spider, 2 hours earlier, and now a man's arm was at risk. Start the treatment, I told Sarah. Methylprednisolone, 125 milligrams IV. Then dapsone 100 milligrams, PO, diphenhydramine 50 milligrams IV. And let's get him admitted. Observation unit, close monitoring. Sarah nodded and began preparing the medications. The next hours were tense. Every 2 hours we checked his arm. We marked the redness, measured how far it had spread. In the first 4 hours, it had reached from shoulder to elbow. Then it began to slow down. The drugs were starting to work. But the bite site itself was getting worse. The grayish area was growing. Now it was 3 centimeters in diameter. And in the center, a small blister had formed, filled with fluid. When I saw that, I knew surgery was inevitable. The next morning, plastic surgeon Dr. Elena Martinez arrived. She looked at the arm, shook her head. Needs debridement. Today, the sooner the better. How much tissue? I asked. Hard to say until I open it. But at least 8 by 8 centimeters, maybe more. I'll need to go deep, down to healthy tissue. We told Michael. He listened quietly. Do it, was all he said. I don't want to lose my arm. You won't lose your arm, Dr. Martinez said, but you'll have a significant wound. We'll have to do skin grafting later. Rehabilitation will take months. The surgery was performed that afternoon. It lasted 2 hours. When Dr. Martinez came out, she looked exhausted. It was worse than I thought. The venom had spread deeper. I had to take muscle tissue, not just skin. The triceps was partially necrotic. I removed about 10 by 12 centimeters of tissue, down to the bone in some areas. Bone? I asked. The venom reached the bone? Not quite, but close. Another day or two, and it might have caused osteomyelitis. He's lucky you caught it when you did lucky. Michael probably didn't feel lucky. But Dr. Martinez was right. If he had waited one more day, if he had just said, it's only a bee sting, it'll pass, and stayed home, the outcome could have been much worse. Losing the arm was a real possibility. After surgery, Michael was taken to the ICU. The risk of infection was very high. We started him on broad-spectrum antibiotics. His wound was cleaned and dressed daily. 3 days later, he was moved to a regular ward. A week later, he went home, with a home care nurse assigned to him. 6 weeks later, the first graft surgery was done. Skin was taken from Michael's thigh and transplanted to his arm. It held. 2 months later, the second surgery was performed, this time for muscle reconstruction. Muscle tissue was taken from another part of his body and placed in the triceps area. It partially worked. Physical therapy began. Michael had trouble moving his arm at first. For 3 months, he went to therapy every day. Slowly, function started to return. 6 months later, he could lift his arm and carry things. But it wasn't the same. It would never be the same. A year later, Michael and Jennifer came to my clinic for a follow-up. Michael's arm had a large scar, running from wrist to shoulder. The skin graft marks were obvious, but he could use his arm. "I even go to the gym," he said. "I lift light weights." The doctor said it's okay Jennifer was with him, smiling. "We haven't gone on a picnic since that day," she said, half joking, half serious. "Every time I see a wooden surface, I check it." "Is there a spider?" the kids say. "Mom, you're paranoid," but I don't care. "Michael, let me tell you something," I said. "You acted fast. You called 911. You came straight in. Most people wait. They say, it'll pass, and they stay home. You didn't wait. That saved you." He nodded. Jennifer insisted. I said, "It's just a bee sting." But she said, "No, we're going to the hospital." I'm glad she did. After they left, I went back to my office. I stood by the window and looked outside. I thought about Riverside Park, those old wooden tables, those dark, damp corners, and the things that live there. Invisible, silent, dangerous things. Brown recluse spiders live like that. Just as their name says, they live reclusive lives. They like dark places, basements, attics, old furniture, piles of wood. They hide during the day and hunt at night. They don't actually want to bite humans. They only do it when they feel threatened. Michael was a threat to that spider. Under the picnic table, with his flashlight, tightening the screws, he disturbed the spider's home. The spider got scared, and it bit. Pure defense instinct. And that one small defensive act, that 1 second bite, changed Michael's life. The venom, loxosceles, is so powerful that even a single drop can destroy tissue. It bursts cells, breaks down proteins, dissolves blood vessels. The body fights back, the immune system attacks. But that reaction only makes the damage worse. The result is necrosis, tissue death, irreversible damage. And there is no antidote. No drug can neutralize the venom. All we can do is slow it down. Steroids to reduce inflammation, antibiotics to prevent infection, painkillers to ease the suffering. But dead tissue cannot be brought back. It has to be cut away. Michael was lucky. He came early, we diagnosed it early, we treated it aggressively. We saved his arm. We saved most of its function. But not everyone is that lucky. 2 years ago, I saw another case. An older woman, 67 years old, bitten while working in her garden, on her leg. She waited 3 days at home. "It's nothing," she said. When she came in, she was septic. Her kidneys were failing, her blood wasn't clotting. We had to amputate below the knee. And 2 weeks later, she died in the ICU, multi-organ failure. 3 days, just 3 days of waiting, and she was gone. That's why I tell people, if you're bitten, if you see rapid swelling, spreading redness, severe pain, don't wait. Don't say just a bee. Don't say it will pass. Because maybe it isn't a bee. Maybe it's a spider. Maybe it's a brown recluse. And if it is, every minute counts. And if you go on a picnic, be careful with old wooden tables. Don't sit without checking underneath. Use a flashlight. Because down there, in that dark corner, there might be a small brown creature, invisible, silent, waiting.